at the end of the session. You can find that evaluation form that will be in our chat, or you can also find that in the email link that was sent to you. Again, we want to encourage you to be able to participate and get the most out of today's presentation. You know, we all learn from one another, and this is that opportunity. So ask questions, and we just ask too that when you do present any specific case examples, that you remain HIPAA compliant and not provide any of the patient's social information like birth date, address, or other details. So my name is Sara Tompkison, and I'm a social worker by day and a Tai Chi instructor at night. Seriously speaking, today I do want to share with you how I've been able to use Tai Chi to promote kupuna health and wellness. Okay, so let me get my slides up. All right. So in some of this presentation, some of the slides, with the permission of the memory care home where I teach Tai Chi, I got the family's permission to be able to show some pictures of the residents. This one is really quite remarkable because it features my Tai Chi instructor, or my Sifu, Elena Ferra, and she was demonstrating the importance of balance for people. And regardless of whether you're in good physical health or you have limitations, everybody can do Tai Chi. So she was showing them how to use the bean bags to keep upright and to imagine that there was a golden thread attached to the top of their head. There are 3 learning objectives that we have for the group today. And one, of course, is to be able, for you to be able to describe what the principles of Tai Chi are at the end of this session, and to also be able to explain how Tai Chi supports one's physical, emotional, social, and spiritual well-being, especially, again, for our kupuna. And then to be able to identify 2 benefits of Tai Chi or Qigong, which we refer to as deep breathing exercises. So when you think about what is Tai Chi, Tai Chi is a mind and body exercise that originated in ancient China, and it really started off as a martial art. Like yoga, this is a form of moving meditation, and it includes not only a series of gentle flowing movements that create harmony between the mind and body, but you really have to be present and pay attention to your breathing. Westerners, we tend to breathe through our throat. When we breathe in and out, we're breathing just through our throat or chest, but we really don't think about using our lower abdomen, or what, again, Westerners would call diaphragmatic breathing. But in the Chinese practice of Tai Chi, in Qigong, it's actually this belly breathing that we're going to practice later on in the session. And this is to improve your internal strength. And by doing this breathing every day, it actually helps to improve lung capacity, heart function, your kidneys, liver, and even your eyes. So there are 5 major styles of Tai Chi. And the first and the oldest style is what we call Chen. And the Chen is a very fast and explosive movements. So there's these fast, explosive movements with kicks, but it's also combined with slow and gentle movements as well. The most popular form or style of Tai Chi that we probably know of here in Hawaii is called Yang style. And that is characterized by gentle, large frame movements. So this is like parting the horse's mane, very large and very slow and slow moving. House style focus on internal force, and it's lesser known. I haven't researched to see who's doing house style here in Hawaii, but it is one of the other styles, along with Wu style, that is characterized by softness, and there's an emphasis on redirecting incoming force with a slightly forward-leaning posture. And lastly, what I want to share with you today is the youngest form of Tai Chi, and it's called Sun style. It's pronounced Sun, like S-O-N, but it's spelled S-U-N, Sun style. And what's particularly of interest about the Sun style is that the forms have a lot of Qigong movements, and it's characterized by lively steps and a higher stance. So a higher stance as though you're sitting on a high chair, whereas Yang style is more lowering, bending of the knees, lowering of the quadriceps. And for a lot of adults, not just our kupuna, that can add strain to your knee joints. So Sun style was really focusing on what they could do to help people living with arthritis and then prevent falls. And Dr. Paul Lam, who's an Australian physician, actually modified the Sun style, and he developed movements that were in line with people, again, that had certain physical limitations due to arthritis. He founded the Tai Chi Healthcare Institute, and this institute has been around for more than 20 years. That's what we'll do. Again, the Tai Chi for Health Institute is an evidence-based practice for falls prevention of older adults. It's not only it has been adopted by the Centers for Disease Control, but here in the state of Hawaii, our own Department of Health, EMS, and Falls Prevention Program has adopted this program. If you go onto the Department of Health website and you look for the EMS and Falls Prevention Program, you will actually find information about different sites that offer the Sun style Tai Chi, not only on Oahu, but the neighbor islands as well. This form of the Sun style is also recognized by the National Council on Aging. And did you know that in Hawaii, I know before the pandemic, we were the #1 state that had the least amount of falls compared to other states. So that's fantastic. So you may be asking yourself, well, what are the benefits of practicing Tai Chi? Well, we know that it does improve health and wellness. In addition, it can help with one's attention span. It can help relax or calm one's mood. And the most important thing about Tai Chi, which I like, is anyone can do it, no matter what age you are, no matter what your level of fitness is, you can still practice Tai Chi. It's very low impact and safe when practiced correctly. I like it because unlike yoga, you have to, have certain tools. You have to carry a yoga mat, or you might need some supportive devices for yoga. And yoga is a good thing, but I like it because when I travel, I can do Tai Chi in the hotel room. I need 3 by 3 feet space. I can go outdoors and just do it. Again, another benefit is because the movements are deliberate, it helps people feel grounded and present in their bodies. And it does improve lower body extremity strength. And I'm sure our physical therapist, I hope she can weigh in when I ask for feedback and comments from our hub. And there's probably more benefits, but the last thing I want to talk about is how Tai Chi cultivates one's life force. So Chi actually refers to that life force inside of each of us. And it's like our brain. If we're only using 10% of our brain, that's the amount of capacity that we're making use of, our cognition and intellectual aspects. But same thing goes for the life force inside of yourself. You want to grow that Qi, or inner life energy, to flow not just smoothly and powerfully throughout your entire body, but I've talked to my clients, my family members, and for myself. You start to feel that with your blood circulation, with your breathing improving, with people feeling much more happy, and joyful. So Tai Chi and mindfulness for wellness. As I mentioned, the mind-body exercise that was developed in China. And we talked a little bit about how it's moving meditation. that includes those gentle flowing movements. And that Qigong is deep belly breathing to improve internal strength and health. And this is really key. I have found, again, too, with the residents I work with, that in terms of how they feel less anxious, less confused, disoriented, I've tried to do it during times of the day where people, you might have heard the term sundowning. And it's an interesting phenomenon, which happens anywhere between 12 noon to 4 or 5 p.m. But I purposefully offer Tai Chi at 3 p.m. to catch those people that are starting to feel restless, bored, irritable, and just am able, by gathering their breath, by getting them to focus on that breathing, to relax and calm down, and then they play Tai Chi. And lastly, Tai Chi, when you have to be aware of what's going on around you when you're doing or playing Tai Chi, you really cannot afford to be distracted. I remember I was doing the set, and I think I was thinking about maybe the Geri echo. And I lost track of what my movement was going to be. I mean, the next movement, because I was thinking about something else that really had nothing to do with what we were doing in that moment. So it really helps you be more aware of blocking out distractions. This is my fellow Tai Chi colleague that was in China last month. And he actually folded up a stick. He was able to take it. And the last picture on, this would be right, with his doing golden pheasant, that leads to the Great Wall of China. So it was just marvelous to see him do this. But let's focus in on what are the principles. The first principle, which people probably develop later on as they feel more comfortable with their movements and their body, is what we call Dantian. Dantian is believed to be the center of energy that's stored and is connected to the rest of the body. It's also known as, we also know it as probably the core. And so think about how the location of the Dantian is in the lower belly, with one thumb, which is one thumb width below the navel and two thumbs width inward behind. So visualize that it's actually behind your navel. And then for women, they usually put their right hand on top with the left covered. And for men, you would do it the opposite way. But Dantian acts as a center point. The Dantian is the center point. It helps you to be, again, to sense your entire body as you're moving. So it's the Dantian that's, think of it as the motor. And the hands are just going along for the ride. It's that physical center. And I think in the last bullet point, I mentioned that it's the foundation for balance, for breathing, for being standing rooted, and just a full body awareness in martial arts and Qigong. The second principle has to do with breathing. And for a lot of us, we don't realize that when whether it's Tai Chi or some other, even yoga, people tend to hold their breath, and that blocks the energy. So you want to try to continue to breathe in a slow and consistent manner. Breathe with inhaling through your nose. If you can, then you proceed to exhale out all the way down to the diaphragm through your nose. Some people, if they have COPD or asthma, I'll just tell them it's okay to exhale out through your mouth. Again, it's what people feel most comfortable with, and we always want to emphasize safety. So you breathe with a focus on using your Dantian or belly breathing. And I just mentioned how you would place your hand position for practicing that, and we'll do it towards the end. The last two principles have to do with body posture. I mentioned again, it's important to sit upright. A lot of times our elders start to sort of in a chair, they're sitting for so long, and they don't have that strong of a core muscles or their quadriceps, so there's sort of a sinking into the back of the chair. But if you were to sit there in your chair and I asked you to grab hold of your arms and to cross them, lean over as such, try to breathe. Do you find that you can really breathe this way? It's probably hard, but when you open up your arms, you place it down to your side, and you're sitting up nice and tall. Take a breath in through your nose. Slowly exhale out through your nose or mouth. And you'll find that that probably feels much more comfortable. Keeping an upright posture has shown that it strengthens the deep stabilizer or core muscles. But those stabilizer muscles are also connected to your spine or back. And that's the other good reason for having posture, good posture. And what's more, when you're upright, you feel stronger, you're more positive, and your chi is flowing better in a well-aligned body. Balance is an essential part of Tai Chi. Like nature, we are happier and we're healthier when we're in harmony. That's yin and yang, the harmony. So you'll always notice with Tai Chi, everything is circular, just like yin and yang. Yes, hot and cold, the opposites. And balance, yeah, is important to preventing falls. The last part I want to talk about is what we call outward movement. She's doing a movement in yang style, which is white crane spreads its wings. So you're going to think of your movements as being slow so that you can be mindful of them all the time. Just as you breathe in, you're integrating the mind and the body to foster serenity, and just allow your body to flow continuously. Imagine like you're water in the ocean. And when you're swimming in the ocean, we don't swim like this. We swim, it's hard because you have to fight against that resistance in the ocean or the water. So think of it as you're moving in water. The continuing flow allows you to gather the inner energy like hydraulic power, and that grows as it flows. And so does your chi. Move as though you're moving against a gentle resistance. Every movement to generate a soft inner power. Internal components, probably we see that students and practitioners start to develop an understanding of these internal components later on in their practice. But it's important to mention it that when we talk about loosening or songing the joints, if you think about your joints primarily in your shoulders or neck, you know, you just want to loosen it as though the joint is sinking in and down towards the back. And just to relax. Tense joints hinder the flow of chi. There's no way that the chi, if I grab my elbows tight like this, the chi can't flow underneath my arms. We also have meridians that are in between the hands. And after a while, when you practice this open and closed breathing, you can actually feel sort of heat or a magnetic movement over a period of time practicing. And consciously think about how you're gently stretching your joints from within. So that's something that you visualize so that you can internalize how those joints are stretching. So I like to tell people when we do the warm-up stretches, and we'll do a couple of warm-up stretches, I will cue you to imagine that your back is lengthening. Every muscle is growing. You actually feel like you're 1 inch taller. And when you song the joints, when you song your joints, your chi does move smoothly and powerfully. The song strengthens internal ligaments and muscles, which enhances the function of the joints. Lastly, Jing is to find that state of mental quietness. It's a meditative state. You're more mindful of the present and yourself when you're in Jing. Allow your mind to be quiet from within. And it's very hard for me to do that. I don't know, maybe other people have, it's something I have to keep looking at, is just blocking out other thoughts. And it's not even the physical, just thoughts, because I think we all tend to have so much on our plate, so we're multitasking, and those things interfere with just a quiet mind. So Tai Chi for balance and strength. I wanted to see if we could show you this little video. John, are you able to pull that up? And this kind of addresses what I talk.
In this Tai Chi class, people may be equal, but health risks are not. Mayo Clinic endocrinologist Dr. Robert Warmer says as we age, we lose muscle mass and have a higher risk of falling.
You break a lot of bones by just falling. And so anything you can do to help with balance can help as well. So we like what are called non-impact balance exercises.
Dr. Wormer says any type of non-impact balance exercises 2 or 3 times a week is beneficial.
Only one, though, has actually been shown to prevent falls, and it's Tai Chi.
Tai Chi is an ancient Chinese martial art form focused on gentle movements. Along with preventing falls in seniors, it's been shown to also promote balance, control, and flexibility, allowing older adults to enjoy movement who may not otherwise get exercise. For the Mayo Clinic News Network, I'm Vivian Williams.
Okay, and I'm gonna. Thank you, John. Please feel free to enter any questions that you have in the chat. I'm just gonna, I wanted to make sure that we had a chance to do some Tai Chi warm-up practice for your mind, but these are 2 thoughts I have for you today. For the mind to control the body, it also means the mind is calm and has great clarity and concentration. Tai Chi will not only help you to remember your movements, but will create a lifelong journey of integrating your body, mind, and spirit. And in the little picture is the house dog Cookie that can even do Tai Chi. Actually, she does kind of calm down when we're doing Tai Chi. Okay, so I am going to stop sharing and I'm going to have you join me in some of the Tai Chi warm-ups. Okay, and hopefully you can see me. So, John, can everybody see me here?
Yes, it looks good. The audience can change to speaker view at the upper right to see the whole picture.
Okay. So I want to ask if you are in a place where you can stand. You might be in an office. You don't need too much space, what we're doing. You just need probably 3 feet. And I want you just to step out with your, so I'm going to mirror your image and I'm going to cue you what foot to move. Even though I'm moving my left, you're moving your right. Okay, so step out with your right foot. We'll just start first with some Qi Gong breathing. The hands are out to the side. Slowly raise the hands up over the head and breathe out slowly. Gather the good positive thoughts, lift them up to the heaven, and gently press to the earth. And the last one, I want you to be thinking of one thing that you're grateful for today. And then share and release that.
Sarah, you might want to move your camera up a little bit. And also you can, for those who want a better view of Sarah, you can double click her image at the top of the Zoom.
Is that better, Justin or John?
Yeah, it's much better.
Okay. So we're just going to do warm up of it's midday. Most of us have been sitting at the desk or on the floor. So we're going to do some neck stretches, back and spine stretch, shoulder stretch. We always work 6 joints, but we'll do at least 4 of the joints because I want to take it back to the hub for their input. So you start with the hands to the side, your right foot steps out, 2 fists width. That's very important to keep balance, okay? Fist width. If it's too close, that's where people start to lose the balance. So about 2 fists width, 2.5. Your head is down, your hands come up. This is a back neck stretch. Open the palms to the front. As you bring the hands into the chest, it's a chin tilt. So when I chin tilt back, I'm stretching the back of the neck. So it's the chin tilt, breathe out, pushing away, slowly lower the hands. So we'll do that 2 more times. Breathe in. Come up, breathe out, open the palms, breathe in, palms in, chin tuck, push away out. Slowly lower the hands, lower the head. We're going to move forward. We'll do sideways neck stretch. So both hands come up. Let your left hand protect your left hip. Open up your right hand. Look at the middle finger on your right hand. Now, 70 degrees, move that hand to the left shoulder, right shoulder. Your eyes follow the middle finger. Bring that hand to the front of the chest. Breathe in, change hands. Move now with the left hand. Your eyes follow the left hand out 70 degrees. Come back to the front of the chest. Good, switch hands. We're gonna add the breathing. Breathe in. You look away with your eyes, breathe out. You breathe in as the hand comes to the front of the chest. Push down, switch hands, breathe out. Then one more time, breathe in and out. Our spine. So imagine on your left hand on the top of your chest, the right hand on the belly button. That's the Tai Chi ball. So if I ask you to flip the ball, the top hand comes down, bottom hand comes up, and reach like you're yawning, stretching in the morning. And then always make sure the opposite hand's protecting the hip. And try to relax, okay? So back with the ball. Now the right hand's on top, the left's at the bottom. Flip the ball and gently reach up to the heavens, other hand down to the earth. Last 2 times, breathe in. Breathe out. Last one, breathe in. Breathe out. Good, your spine. Get back to the Tai Chi ball, left hand on top, right hand at the below. So you're gonna move your ball to your right knee, but you see what's moving, move your waist. It's the hands are just going for the ride. Then the top hand comes down, bottom hand comes up. Move your waist to the left knee first, and then the hands follow. Flip the ball, move your waist first, and then let the hands follow. There you go. Last time, flip the hands and move the waist to the left knee. Take both hands out and down. Shoulder rolls, 3 times forward. So the rolls are not Western. So you have to think of your joint. So you're lifting up to the ears and then just a little joint move forward. There you go. 1, up to the ears, 2, and last one, 3. Backwards 3 times up to the ears. Squeeze the blades of the shoulder down. 1, breathe in, breathe out. Last time, breathe in, breathe out. Last shoulder stretch, hands up. We did this in the beginning, breathe in. Now slowly breathe out. I feel everybody's moving in harmony. I can see you're all breathing and you're all exhaling. That's why it looks so calm and serene. Last one. And the last joint's going to be for the hips. So for your hips, I want you to imagine that you're going to hold up a wall. So imagine on the right side, you're pushing your left arms out, your right arm's out, your left hand's underneath, pushing the wall, and I'm stepping out just slightly with my foot. That's working your hip. Step back in with the left foot. Imagine pushing now the left wall. Step out with your right foot or toe. Come back in. And 2 more times the other way. Breathe out. Step out. Breathe in. Breathe out as you push. Breathe in. Okay. Palms open. You're going to punch with the left hand. It comes in. Just relax. Soften your knees. Punch with the other. I just want you to get the punching movement. One more time. Left and right. So you just get the movement. Okay, so now you know. And with the punch for Tai Chi, it's not like karate. Imagine you're holding raw eggs in your hand. So now you're going to shift your weight to your left leg. You're going to point your right toe and then punch. Then you're gonna come back. Transfer the weight to the right leg, then step out with the left toe punch. Good. One more time. Breathe in. Breathe out on the punch. Breathe in. And breathe out on the punch. Very good. Let's do one breath. And the Tai Chi salute, your left hand is up. The 4 fingers, the 5 fingers actually, those 5 style of Tai Chi, those are the first 4 fingers. When you bend the thumb, this means humility, respect. With the opposite hand, making a fist, that's your right hand, the fist goes into the palm. This means friendship. That's a Tai Chi salute. Thank you. So I want to just share with you in the last slide that we have some resources, and then open it up to the hub and to other people. So these are some of the resources that you might consider looking into if you're interested. I don't know if Dr. Kapono Chang is here, but he's a certified Sun style instructor. He just got certified to teach Tai Chi. So that's where you can find out more at the Tai Chi at the website if you want to get certified. There's the Fall Prevention Resource Guide for the Department of Health. All the YMCAs here on Honolulu, including the Big Island and Hawaii, they have the Tai Chi for arthritis. Tai Chi for arthritis and falls prevention. And there's a great book that was written by Peter Wayne and Mark First. It's the Harvard Medical School Guide to Tai Chi. And their Harvard Medical School is doing continuous research on Tai Chi. And lastly, Dr. Paul Lam himself has a book called Teaching Tai Chi Effectively. Thank you.
Thank you, Sarah. What an excellent presentation. And we love the exercise that you gave us this afternoon to all of us. I'm so happy to learn the Tai Chi salute. Thank you for an excellent lecture and sharing the resources. I had no idea that the Department of Health has a listing of all the Tai Chi resources. So that is very helpful because my patients ask me, where can I go? And now I know we can find that at Department of Health website.
I forgot to mention that Lanakila Multipurpose Center also has a couple of Tai Chi classes, and that's free, I believe. I think there's like an annual fee, but it's great. Thank you, Dr. Rita Bell.
Awesome. And can you share a little bit about, I know it's really good for people with arthritis and falls and Parkinson's. What about dementia patients? Can you tell us about anything in this field about Tai Chi for memory?
Yeah, so about just when the pandemic, before the pandemic occurred, I had wanted to try doing Tai Chi for people that were living with brain changes or memory loss. And so I had the opportunity to try that out with one of the memory care homes. And it was just amazing because it's when I mean, they can talk. So I just would ask them, what do you like about the Tai Chi? And they said, it makes me feel good. I feel happy. Good. I said, when you're happy, I feel happy too. But the amazing thing was to me, for some of us instructors, knowing that a person is having those challenges, if you can make it simple where they can follow you and you just watch as they follow, they start breathing, they start relaxing, and they start enjoying themselves and playing in harmony. And so the feedback has been very positive from them. It's been positive from the staff. They say they look less agitated, restless, less confusion. And we do it usually during mid-afternoon because we know I was telling the group earlier about this phenomena of sundowning, and I wanted to see if it would help. So the staff certainly and the administrators see the value in I continued to teach there at the memory care homes. Yeah.
Well, that's fantastic. I'm glad to know we have one more resource for sundowning. Thank you, Sarah, for sharing. I'll let the other Hub team members share their thoughts and feedback. Susie, would you like to go next? I would love to hear what physical therapy has to say. Sorry, you're muted.
Okay, can you hear me now? Okay, good. So I was certified with under Dr. Lamb's Tai Chi for arthritis and fall prevention program. And so I do utilize the movements, the Tai Chi movements, with my patients. What I really do love I love the cross body movements and the slowing down. And cross body movements, they're very functional movements. We move like this. We move in we don't move just in a frontal or sagittal plane. And the movements of Tai Chi really do represent our real movements. And then I love the breathing, and that what happens is that they become more aware of their bodies as well. When you start slowing down movements and when you start breathing, a patient can actually become more aware of their body. Even dementia patients, I've utilized it with dementia patients as well, and modified versions. And I see tremendous results with Tai Chi and the movements.
Thanks, Susie. I think Dr. Saltman had a question, Rita, about using seated Tai Chi. So Dr. Saltman, that's what I do, is I do seated Tai Chi, because for one reason, people don't have that standing balance. For the people that are, I've even done it with people that have other kinds of physical conditions. I've had people with COPD, and for those people, I say, "Ooh, you know what? It's always do what you feel is comfortable for you. I don't want people to be short of breath. I don't want people to, hurt their backs or fall." And so I'm just showing you how I sit. It's, just tell them keep both feet planted on the floor. And most people are tiny. They're 4'11". So we try to get the right chairs where they can, dining room chairs where they can sit forward, and I do sometimes those exercises because they don't think about their breathing, and they go, "Oh, how can't breathe like this." So relax your arms, open up your chest. "Oh, much more better, Sarah." That's why we're doing this. So yeah, and I don't know if someone can speak about proprioception, because that proprioception thing, right? Tai Chi really helps people be aware of that aspect. Susie?
Oh yeah, well, that's part of the body awareness, and
Yeah.
that is, yes. And so as you are as you're stepping forward and you are stepping on your right foot, okay, so what's happening is you're utilizing your vestibular system, your proprioceptive system, and your visual system. All those systems are saying, okay, my foot is in front of me. And then what's happening is those proprioceptors are going up to the brain and saying, okay, now you have to stabilize.
Mhm.
So yeah, I love it. And I love, I modify the movements a lot. But what I particularly like is the slowing down and the breathing. It really, I think as healthcare providers, we don't really talk about your breath. And your breath is really, really important. When we do this, even when we're walking, an older person, they're walking and they're so stressed out, that they're so tense, they're going to be more at a risk of falling versus, be aware of your body, utilize that breathing to help calm those body systems down.
Yeah, excellent point. Thank you for the question, Dr. Salt.
Reese, would you like to share from a pharmacist's point of view about benefits of Tai Chi or any comments you have on this presentation?
Yeah, so well, that was my first time ever doing Tai Chi, and I really enjoyed it. The closest thing I could think about was kind of yoga, but I know it's not quite yoga, but it's definitely about the core with the focus on that. And I didn't realize how important breathing was a part of the Tai Chi motions and movement and Qigong, I think.
Mm-hmm.
And then when it comes to the 5 styles, the Chen, Yang, Hao, Wu, and Sun, I just want to confirm Sun is the one that has the most evidence. Is that correct? So if
That's
I had an
correct.
older
It's the
adult
Sun style.
okay,
Yeah.
so if the older adult talked to me about Tai Chi, I should make sure that they sign up for the Sun style form, correct?
Yeah,
And I'm
because
guessing most of the
some
styles
people
out
will
there.
do Yang style,
Mhm.
right? And this is kind of hard to do, right? Because again, it's everything, even to creep down to snake in the grass. So this is what I'm learning now is Yang, but I had to start with Sun style just so that it would help with my balance. But it's all breathing. I couldn't even, my balance sucked. It was so bad. And I started Yang about a year and a half, Yang style. But I like both. Because again, with the Sun style, what's different is with Yang style, your feet are always planted, right? But with the Sun style, the balance comes in because there's a follow step front, back, and a follow step front. And you see how the higher stance is? It's just that this is a higher stance. So you're more stable too, as opposed to getting down low when you, like for the Yang style, it's a lot different. They're brushing like that. So, and the Chang is even worse because all these, like, yeah. So again, it's martial arts. I mean, like behind the Tai Chi movements is martial art focus, either blocking, a defensive move. We don't do it. We don't attack people. We learn how to take that aggressiveness, deflect and give it back. That's why I like Tai Chi, because it's not aggressive.
And I think Dr. Lamb's program, the Tai Chi for arthritis and fall prevention, I believe that has been researched. And when they say, you know, that it is a method that has been shown to prevent falls, I believe that's Dr. Lamb's program as well, that has been heavily researched. And that's a good starting program for, you know, anybody who's starting out with Tai Chi.
Dr. Saltman has a question. Oh, you got to take yourself off the mic, Doctor.
Of course, I have lots of things to say about it. Sarah, it's great to see you. This is the most animated and engaged I've ever seen you on the geriatric echo. So I'm delighted to see you talking about Tai Chi here. That's just great. And so I want to say something about these styles. You know, there's different styles, but there's a principle in Tai Chi that there's one body. You know, there's one body. And that body is the body that does yoga and does any style of Tai Chi and does any kind of athletics or movement or anything. And so I think it's important to remember that we all carry around our one body and that the movements that we do with that body, you know, become our way of getting around in the world. And so you know, there's been a lot of studies on Tai Chi, and those early studies, I think, preceded these newer sort of therapeutic thinking about Tai Chi. There's kind of, so those are likely to be Yang style studies in the earlier years about that were about fall prevention. So again, styles are styles, but there's not one style that is superior in your body than another style, because it's one body. And the other thing, you know, I didn't hear it, you did mention it just now about Qigong. And Qigong is, you know, is a little bit different, is kind of a subset of all of Tai Chi, I guess I would say. And it allows for, and it often is referred to as breathing exercise. And so these are these things, and I would say that what you showed us is more like Qigong than it is more like Tai Chi, but I don't know. So I wanted to hear where Qigong fits into the way you wanted to talk about it.
Yeah, good question. So I was just doing the warm-ups, and so that's probably why we weren't doing a set. If I did the set with the waving, the single, I mean, we would start with just teaching people maybe the single whip and then waving cloud hands. Because it sounds like, Daniel, you've done some Tai Chi yourself. So no, or read about it.
40 plus years.
Yay. And that's a good statement, because you know what, people, if you know, as a Tai Chi practitioner, you'll hear people from different schools thinking, the Sifus don't say this, but students will think that their Tai Chi is better than the other style of, but yeah, I'm of the same philosophy. I'm always open to learn from different Sifus, to learn from my peers and students. I mean, I'm always learning. And the best part is when you catch yourself doing something, because I'm zoned out. Have you ever found that? I mean, for anybody on this call, if you have multiple things to do in one day and you're trying to take a Tai Chi class, or you've got to really be able to focus on leaving all your worries, all your cares at the door. And that, to me, sometimes easier said than done, because you've got your cell phones. And unless you silence the cell phone, you've got your iWatches, you've got all these distractions. So I'd be curious what people do, whether even for yoga, what do you do to just kind of remove yourself, right?
You know, I think it's close to that, really, and that your attention, we used to say that you know, the chi moves the muscles and the will moves the chi.
Yeah.
And so you can, but you know, these days, and this thing about inhaling and exhaling, I've really been influenced by Feldenkrais,
Ah,
and so people who say, you know, nobody really knows if it's better to inhale on the extension and to exhale on the extension. I don't think anybody really knows the answer to that. When you inhale and when you exhale in an arc of motion, an arc of movement. So there's a lot of interesting things that happen when you do the opposite of that. And I don't think there's anything wrong, provided you maintain the basic principles that you're talking about, which is centeredness and center of breath, breathing to Tompkison, sinking the weight, lengthening the spine. You know, those are the principles that drive these things. I have to say that for years also, recommending individual narrow exercises as therapeutic intervention for musculoskeletal problems is a really effective clinical intervention that is non-pharmacologic treatment for musculoskeletal problems. And there's nothing wrong with it. It really works, and it's just great. I would recommend those of you in primary care to think about those kinds of things that might be effective in that work.
yeah, and if you just do like 10 minutes of warm-ups or 5 minutes of breathing, right? It's just amazing how someone in a waiting room can just like, you know, I know I can go see the doctor and tell him what's really bugging me this morning.
Well, there's another principle that's self-correcting, so that if you come over to the place that you're not fully 45 degrees, on the next movement you have to your center or pull back to the zero mark or whatever it is. There's a self-correcting thing, and that's this kind of about distraction. So I think you can actually, in practice, you can sort of, if you have enough time, you can walk away from it and come back you less off
Right,
as well.
right. But I think before ending, I don't know if anyone has questions. I think the point you make too, Dr. Solomon, is Tai Chi is a personal journey. So if you're new at this, people get easily discouraged because they're expecting themselves to remember the full 24 or the first 4 movements. Who cares? I mean, like, to me, when I'm practicing with the students, I say, you know, I want you to be happy. I want you to enjoy yourself, because you'll come back. And just, if it's just learning one thing today, like how to start, to commence, to open, that's good enough. So it's a personal journey. Wouldn't you agree?
I would, and I have to say that when I started, I never heard anybody describe the things as the 24 or the 36 or any of those kinds of ways of describing the set. There was kind of the short set and the long set. It was kind of it. And then you know, then the Qigong things, there's the 8 jewels and the 10 Taoist exercises and the Adam Meisner's 11 warm-up exercises and the 5 loosenings. The 5 loosenings, those things had sort of numbers attached to them. And those are all Qigong things. I would encourage people to look at those 5 loosenings. I love them.
Yeah. So you mean the elements, the 5 elements of earth, water, fire. Is that what you?
It's a strong cultivation exercise.
Okay. So just cultivating. Okay. Yeah. All good. Thank you.
Do we have questions from our other attendees? Any comments? Anyone wants to share a case? Sara, do you have any story to share with us about a family or a senior who really benefited from Tai Chi?
You know, there was a gentleman that definitely, he came up to me and he said, you know, I want to apologize because I have memory problems. I'm seeing Dr. Corey Liao for my memory problems. I said, oh, you know, I'm just so glad you're coming to class. And I said, how can I help you? And he said, well, I don't remember what you're telling me to do. And I said, well, give yourself time, because I know that your heart's in the right place. And he still would continue to come. And I did tell him, you just do the best, you just practice, do the best. And over time, and I do believe this, maybe even for people with varying degrees of brain changes, you have something called muscle memory. And if our wonderful PTs there, we have found that if people keep doing some of these movements, the muscle memory, at the end of the 9 months that I did this Sun style, it was a grant that they received during the pandemic, and I volunteered at Kali YMCA. This same gentleman, I saw improvements in his confidence, his mood, and he did get some of the basic movements. And I said, you know, I'm so proud that you stuck this out, and you're doing very well. Don't forget this. You're doing well, and I'm just so proud of how you put your best foot forward. So that's someone that's still grappling with those changes with his brain, but that was rewarding for me.
Don't discount, just because a person has dementia, they still, what Sara was saying is that muscle memory, they still have muscle memory. And they, you know, and that's what we will tell family members all the time. They go, oh, they have dementia, so they're never going to remember, and they don't, you know, so they don't need therapy. And you know, our job as physical therapists is to, you know, be that person that's there, like doing these activities consistently, knowing what they can do, you know, in terms of their motor skills. And you'll be surprised that, you know, someone with dementia, mild, moderate dementia, they can still follow directions. They can still do, you know, the movements, and they can still build, you know, some muscle due to that motor memory. So that is I think what you were just saying, Sara, about the motor memory, or muscle memory is a good take home point for everybody.
Well, thank you for validating that, because I think some people think that I'm crazy when I say no. And even for a patient, a person I had with Parkinson's was very interesting. She said, Sarah, I know what you're telling everybody else to do, but I'm like one movement behind. And oh, I need to do something differently. So I had her also use the chair and we did cueing. So I did the cueing a little more in advance. But isn't that great that you can have students in your class tell you, I know what the movement is, but I just feel like the way my brain is working, it's working so it's slower for me to
Yeah.
catch up to it.
And sometimes do you do it to music? Because music can
Yes.
help. Okay.
It's always to music
Help
and
that
it's
beat with the Parkinson's can help facilitate the movement.
So I think that was the best class I ever taught because we had a mixture of people that were healthy. I had a 94-year-old woman that was like, oh, 94, I'm like, please don't get hurt in this class because your daughter's here, And again, I've had people with memory loss. And the point was, what was really beautiful is that core group of 12 people at Kalihi, they became more of a family. And so they knew that people were having their own challenges, but they were willing to share a story or they gave encouragement. The people that were more cognitively intact, it was just beautiful to see how they were willing to help their fellow.
You could have done your own study.
Yeah, I could have. I know we keep maybe when I retire. Yeah, I think there's a lot to still lot of research to be done with Tai Chi.
Yeah.
So music is kept in a different place, or it's sort of mapped in a different way in the brain than other sort of other things maybe, or than what we sort of frontal lobe, higher thing. And so dance and music or Tai Chi is like dance in that way. Those things are mapped in your body in a way that's not exactly affected in the same way that dementia things. So that you're absolutely right. Parkinson's, all those things have great therapeutic value from doing this kind of exercise. That's slow and centered and balanced and sort of and organized. That's what the teaching of it is about for the folks that are doing it for those programs. It's great stuff.
I just had one other comment to share. Last year, my Sifu and I were asked to teach Tai Chi to the guided dogs programs. What the heck is a guided dogs program? And they told me the people are blind. I said, what do you mean by blind? I mean, like, do they have some kind of visual impairment? No, Sarah, they really are blind. That's why they have guided dogs. So, I talked to a colleague at Lanakila, the blind rehab, and he says, Sarah, the first thing you do is make sure everybody has a buddy. We did it seated, but we had them buddy up with someone that had vision. And it was really interesting, but they could do it because their buddy, the partner would hold their arms and hands. I couldn't do that as a teacher, but they would, okay, now we're going to talk about open and close. So the buddy had their hands I think it was either underneath or over, and then they would just do the motion. And it was amazing how even for people that were blind in a seated chair, because I wasn't going to make them walk us in, they're really focused. They got it like that. The thing about the breathing, about sitting up, they knew, because they're internalized so much. They've had to compensate for their loss of vision. So it was just amazing how their hearing was so acute, their sense of smell, just everything around them. So we did that once, and then they said, come back. And I said, that's a lot of energy for the teachers because you have to reframe how you're, teaching for people that are visually impaired. So that was an interesting experience.
Well, Sarah, we're at the 1 o'clock mark, and I want to thank you. You have blown us away with this Tai Chi presentation. So impressed and so deeply moved at how you have done Tai Chi for blind, to dementia, to more than what we think as the usual candidates for Tai Chi. We've all learned a lot today from the benefits and muscle memory and thank you for driving home these very important points. And kudos for volunteering during the pandemic. You are awesome, Sarah. A gift that keeps on giving. Don't ever retire. Don't leave us. Thank you, Sarah.
Thank you,
all
everyone.
the
Thank you,
attendees.
Rita Bell.
Have a
Enjoy.
great day. Thanks for
Okay.
joining us on
Mahalo.
Echo. Mahalo, everyone.